Breastfeeding has many benefits for both mom, baby, and for the entire family. So it will keep both mom and baby healthy, both in the short and the long term, as well as providing free food for your baby and lots of bonding and connectedness for both mom and baby. It helps keep babies healthy and prevents them from getting sick by getting antibodies through mom's milk, both in the short and the long term. It also can help moms lose a little bit of postpartum weight, as well as keeping them healthy, both in the short and long term. For example, can help prevent breast cancer, uterine cancer, ovarian cancer, also can prevent diabetes and obesity in the baby. There are a lot of misconceptions about how breastfeeding works and how milk is made. So you actually start producing the first milk for your baby called colostrum during the end of the first trimester of pregnancy. So that is when your milk comes in, as people say. After your baby is born and the placenta comes out, that will tell your body to start making mature milk, which typically happens in 2 to 5 days after birth. It's normal to feel like you don't have enough milk in those early days, but the baby's stomach is very small and only needs a small amount in order to fill up. It's important to feed your baby frequently so that you can start up the supply and demand of how breastfeeding works. The more that you feed your baby, the more milk that you will have. If you give the baby too much formula or other foods during that time, the baby may not have appetite to eat, and eating frequently in those first days is what helps to set up the supply and demand way of breastfeeding. It's normal for it to take a lot of practice, and the good news is your baby will need to eat frequently, and that will give you lots of opportunity to learn about each other. If you're having a hard time, it's really important to ask for help and reach out for resources, because there are many people available who are able to help get feeding off to a good start for you and for your baby. Your midwife at the clinic can help you, as well as lactation specialists and the nurses in the hospital as well. Right after your baby is born, it's really important to hold them skin to skin and have uninterrupted time for the first 1 to 2 hours of you and your baby to get to know each other. Ideally, you'll get your first breastfeeding in during that time. The next 24 hours after birth, babies can often be very sleepy, and it's normal for them to not want to feed very much. During that time, the best thing that you can do is to hold your baby skin to skin and also offer the breast if they're interested, but also to stay calm and patient with them, as it may take a little while to get feeding going. Many people might have questions about pumping, and if you're going back to work or school, a breast pump is a great way to be able to provide milk to your baby when you have to be away. Ideally, you wouldn't start pumping until breastfeeding has been well established, usually after the first 4 to 6 weeks. If you need help getting a pump or getting it set up, please talk to your midwife or one of your lactation specialists. Many people are used to seeing babies being held in a cradle position like this. This is a fine position, but also know that for many babies, especially new babies, they find more comfortable and more relaxed to start the feeding in this more laid back position. Babies feel safe and calm, and they tend to nurse really well. The best way for you to remember how to get this set up is for you to be comfortable first. So you be comfortable and then put your baby where they feel most comfortable, which is going to be on your chest. Babies will naturally go towards their food source, which is you, and so you can gently guide them, having them tuck the arm to give a little hug to the breast and bring them down. And babies often will be able to latch on with little to no assistance in this position, and also allows you to be very comfortable throughout the whole feeding session. While this is an ideal position, it may not always work for every baby and every mom every time. So we see other positions that are sometimes used, such as a football hold, in which the baby is tucked underneath the arm. And in these positions, you still want the baby to be close. We also will see babies that are in a cradle position, or sometimes starting what we call a cross cradle position, where the baby is held across your body. In these positions, I would still always encourage you to be comfortable, and then you maybe can lean back so the baby is being well supported by your body. Most important, whatever position that you feed your baby in, you want to make sure to never put extra pressure on the baby's head or neck, because the baby was just born, and so there can be a lot of tension and tightness that can make it harder for babies to nurse comfortably. So we want them to be safe and supported in your arms, but without any extra pressure on their head. We always want babies to have a latch in which they have as much breast in their mouth as possible. Usually we're going to look for a sign that the baby's chin is into the breast and the head is angled back. Just like when you're trying to take a big drink of water or a big bite of food, you'll angle your head back, and that opens up the jaw and the throat. So when you're getting a baby latched on, if this is your breast, you want to make sure that the baby is coming on with the nose lined up to the nipple instead of having their mouth centered over the nipple. If it's centered like that, often the baby will pinch down and not get very much milk. If we have it angled in a way that the nose is lined up with the nipple, baby will angle their head back and open up the jaw and the throat, and able to take in a lot more breast tissue in a comfortable way for you. So it's important to remember that breastfeeding is eating, and all of us eat in different intervals and different lengths of time. Your baby, typically speaking, is going to eat 10 or more times in a 24-hour period, and they won't necessarily be evenly spaced out. Often we see babies eat about every 1.5 to 3 hours, but know that those feedings might last 10 minutes or all the way up to 45 minutes. For a brand new baby, we wouldn't want a feeding to go much more than 3 hours in between so that they are able to take in plenty of food and have energy for their next feeding.
Oh, there we go. Get our little burp out.
Good, so this looks really good. You can even kind of make sure your arm can be nice and relaxed. So see, then you see his head is angled back really nicely, so that we've got the chin into the breast and his nose away, so he's got the nipple angled really far back into his mouth, so that means he can get a really deep latch, get lots of milk that way. If he slows down, this is my little trick called the milk lever. So he raise his arm, and it'll get him to start sucking again. See, and then he said, oh yes, that's what I'm doing. That's what I'm supposed to be doing. You can also use that arm to tell when he's all done feeding. His arm will be really limp and loose and relaxed. And you did a great job of tucking his other arm around you, so he's kind of giving the breast a hug. Babies use their arms to nurse, and so he's able to actually stimulate that other part of your breast there and also have that arm out of the way, so he's able to get really close to you. So it looks perfect and comfortable for you?
Yes.
So one thing too, sometimes to get babies interested in feeding, if you feel like they are not, or if they're a little bit kind of disorganized, as we call it, is to just have them train a little bit on your finger, and we'll see if he wants to suck. And he's like, maybe, he says, what's going on here? Oh, that's different. And so we will stroke the roof of his mouth. That's actually where that suck reflex is. Usually encourage families to use your index finger, your middle finger, so that you can really get back there and stimulate his sucking, which is a reflex for him, but sometimes babies just need a little reminder. And so he's doing really well. So now we're going to place him on your breast in a position that I like to think of more as like a normal, comfortable position where most people will nurse their babies. So you're comfortable. So step one of breastfeeding is making sure that you're comfortable. And then step two, we want to make sure that baby is comfortable, and he has a nice big stretch. And so instinctively, where do you put him when he fusses? You put him on your chest. And so when we put him, so go ahead and just put him on your chest. And this is where babies will feel really neurologically grounded and centered, and helps to bring out their instincts. So I'm going to give you this pillow for your arm, so you're going to have a little nest, and then you're basically the pillow for his body, right? And so he's already saying, here's my food, here I come. And so we'll kind of bring him over here. And then the key will be to get this arm of his tucked around to kind of give a hug in the breast. And then, yep, perfect. Then you bring your arm down, and then you're going to support his body with your arm. And he's a little high. That was great. So you bring him down so he's lined up nose to nipple. And then you see that you don't have to do hardly any work, which is nice. So then you can be comfortable and relaxed. See that his chin is into the breast and his nose is away, which means that the angle of your nipple is all the way far back in the roof of his mouth, and he's able to get on really deeply, also take in a lot of breast tissue, which means that he's going to take in a lot of milk. And so we can look here and see that and it's hard for you to see, but I can see from my angle that his chin is down and the lips are flared out nicely, kind of like little fish lips. If you ever wonder, is he on properly? Sometimes we have a little trick of just even pulling down on the chin gently, and that will help to bring down that lower lip, but he's on really well, so he doesn't even really need my help. We can sometimes also try to flare out the top lip if we feel like that's getting curled in, because you just want to make sure the baby has a nice seal on the breast. The nice thing about this position is that gravity is bringing him onto you and holding him onto you, and will also help to flare his lips out so that he is in a really good position. And we know when he's sucking well, I can even see that his ear is wiggling right here, which is a sign that he's using his tongue appropriately. We see that his little head is rocking back and forth, which is really important for babies, because after they've gone through the birth process, however they're born, all of the bones of their skull overlap and move and shift. Their head and their neck gets a lot of pressure from pregnancy alone, but especially from birth, and so that allows him to move his head and neck freely, and then he's able to actually get onto the breast in a way that's comfortable for him, but then also accesses all the different parts of the breast. this position is often called laid back nursing. It's called biological nurturing, ventral nursing. All of it is really just a lot of fancy words for saying this is comfortable for you. This is normal breastfeeding, and so this is how everybody else on the planet nurses their baby, because this is what makes sense. It's most important for you to be comfortable, relaxed. And the baby, as you first brought him in there, was in this really comfortable position, so he is able to have all of his instincts about him, and you can see that you are basically the pillow for his body, and he's really well supported in your arms. He feels safe. He can look up at you. There's a lot of neurological connections and brain development that happens from the interaction between the two of you at this distance. And so this position is typically where we always want to start with breastfeeding. And sometimes there might be reasons why this position is difficult for a baby to get into. But if a baby has a hard time latching in this position, it's almost always a situation where there's maybe some sort of tension or in the head or the neck of the baby where they can't comfortably get their head angled like this. And then we might do some extra work to help massage the baby's head or neck and help them to relax, or do some extra exercises to improve their jaw motion, their sucking ability, so that this position is comfortable. For some reason, we like to complicate things, and often you'll see other positions like the football, the cradle, cross cradle hold, those sorts of things. And those are actually all considered to be interventions of breastfeeding. So if this position doesn't work well, then we might need to try one of those other positions. And that can be for a variety of reasons. It might be anatomy with the mom or the baby, or sometimes a baby that's born really early, or things like that, where we might need to help them a little bit more. But this is always going to be this is what we call sort of the alpha and the omega of breastfeeding. We want to start this way, we want to end this way. That often, even if we're having to try another position to start, we will ultimately work towards getting the baby in this position, just to see if they can get comfortable, because breastfeeding is a thing that inherently makes you sleepy and tired, and so it's important for us to create a restful position for you as a mom. Even if you're not going to be necessarily sleeping, the baby's really safe in your arms and doesn't exert any extra effort on your body. In side lying position, it's really important so you have your arm in a good place so that you're not going to roll and move. So in this case, we also don't want his arm in the way, so it's kind of tucked down at his side. And we still want him lined up nose to nipple. So maybe I might even scoot his body down just a teeny little bit. And that's good to kind of entice him a little bit.
Can't talk about rooting.
And so you see that he's kind of rooting around looking for it, which is important because that's helping him to open up nice and wide. And you're doing a good job sandwiching the nipple a little bit to help him get into his mouth, which is great. So the key, if you see, I've got a rolled up receiving blanket here. And so I'm going to actually even tuck that between his legs to support him and keep him on his side. And I'm going to scoot him down just a teeny little bit so that he can be on a little bit better angle. And then he can stay on. So this position is nice because you can relax. And you see he did a good job just actually moving his own head so that he could breathe better. So we want you to be able to be relaxed, and part of having this receiving blanket here is so that you don't have to worry so much about holding him, because even if you do kind of doze a little bit, even though you're holding on to him right now, you may relax so much. And so it's nice to have that here as a little bit of support. And so he's nice tummy to you. He's so cute here. He's using his little grasp reflex to hold onto your shirt, which is super cute. And you've got pillow between your knees so that you're in a good angle. And this is another good restful position. And not all babies can do this when they're newborns. So some babies it takes a couple weeks, some babies it takes a few months for either them or for parents to get comfortable doing it. But if you can, it's a nice way to get sleep and nurse at the same time.